Okay, welcome to the first of hopefully many video productions from Fayette County Fire and EMS. Today we're going to talk about scope of practice, administering pharmacologic agents, and classification of pharmacologic agents. Remember from our scope of practice that you as an EMT are going to be legally, morally, and ethically responsible for every drug that you administer. You have to have a good foundation of knowledge of over-the-counter and prescription medications that may interact with the drugs that you give. You must have enough knowledge to obtain a medical history for patients who are unable to communicate. Drug administration has to be safe and therapeutically effective. You should always keep a field guide or other medication reference handy to look up unfamiliar medications and follow standardized national guidelines when providing drug therapy. Methods of drug classifications. Classification of drugs is based on the effect that drugs have on a particular part of the body or on a specific condition. Many of these medications may fall into more than one category. Drugs or medications can be classified in the following three categories. Body system, which is categorizing by the system affected by that drug. Understanding which systems are affected by which drug will help you make the appropriate decisions for patient care. The class of agent, how a medication affects the system. And the mechanism of action, the particular action by which the drug created its desired effect on an organism. Let's look at nervous system classifications. The nervous system, of course, is the body's principal control system. It's composed of the central nervous system and the peripheral nervous system. Central nervous system is made up of the brain and the spinal cord. The peripheral nervous system includes all of the nervous tissues outside of the central nervous system. The ANS is divided into the sympathetic nervous system and the parasympathetic nervous system. The sympathetic nervous system is responsible for the body's response to shock or stress. It's known as the fight or flight division. This response is associated with the release of adrenaline from the adrenal glands. It's called adrenergic because special adrenergic fibers ultimately cause the release of hormones, epinephrine and norepinephrine. These sympathetic responses include shunting of the blood from the extremities to the vital core organs, dilation of pupils, and reduction of digestive system activity. The parasympathetic nervous system relaxes the body. It controls the automatic functions during non-stressful times, often referred to as the rest and relax or feed and breathe division. Stimulation results in effects opposite of the sympathetic nervous system. Some examples are the heart and respiratory rate decrease, constricting the pupils, and increasing digestive system activity. Sympathetic and parasympathetic divisions work in constant opposition to maintain basic harmony in the body. Each division takes more precedence in the proper circumstances. So, drugs that are affecting the sympathetic nervous system, often called sympathomimetics. These sympathomimetics are going to mimic the effects of the sympathetic nervous system, and they're given to produce the same effects as the hormones of the sympathetic nervous system that are released naturally by the body. Sympathomimetics mimic those effects and have the same effects as the sympathetic nervous system. Sympatholytics, or antiadrenergics, are medications that have the opposite effect, or they inhibit the sympathetic nervous system. Antiadrenergics, which are the same as sympatholytics, antagonize or fight against the effects of the sympathetic nervous system. Antagonists are drugs that counteract the action of something else. Agonists are drugs that bind to a receptor and cause a specific response, sometimes over and over. Some medications stimulate alpha and beta receptors, where others are selective to specific receptors. Beta blockers are used to control blood pressure in some patients and heart rhythm disturbances in others. Think back to your alpha-beta. Beta 1 pretty much affects the heart. Beta 2 almost uniformly affects the lungs. Some medications stimulate both alpha and beta receptors, and beta blockers are used to control blood pressure in some patients. They work by filling a portion of the beta receptor sites that beta stimulators would normally bind to. In the hospital setting, or in the pre-hospital setting, you will often administer drugs that antagonize or agonize beta-1 receptors in an attempt to treat cardiac arrest and hypotension. Beta-2 selective drugs cause bronchodilation with very little effect on the heart, which only has beta-1 receptor sites. Parasympathomimetics are agonists to the parasympathetic nervous system. By agonists, we mean that they produce the same effect of the sympathetic nervous system. Parasympatholytics are antagonists to the parasympathetic nervous system. They work in and against the sympathetic nervous system. Atropine is probably one of the most commonly used parasympatholytics. Parasympathomimetics are also called cholinergic medications because they stimulate the cholinergic receptors to which acetylcholine normally binds. Acetylcholine is an important neurotransmitter in the parasympathetic nervous system. These cholinergic medications can act directly or indirectly on the cholinergic receptors. When a drug interacts with acetylcholinesterase, deactivation of acetylcholine does not occur. If excessive cholinergics are present, the patient may exhibit the sludge phenomenon: salivation, lacrimation, urination, defecation, gastric upset or cramps, and emesis. Patients exposed to certain fertilizer, insecticides, nerve agents, and sarin gas exhibit these sludge symptoms. Parasympatholytics are also called anticholinergic medications. They block the two types of cholinergic receptors, which are called muscarinic and nicotinic. Let's talk about some kinds of drugs right now. Analgesics and antagonists. An analgesic is a medication that is used to relieve pain, to produce analgesia, which means the absence of the sensation of pain. There's two main kinds, the opioid agonist and the non-opioid agonist. Opioid agonists are the most common class of medication used for analgesia in the pre-hospital setting. They're similar to or derived from the opium plant. They bind opiate receptors, which prevents neurons from sending pain signals. They are very potent CNS depressants. Fentanyl, or sublimase, and morphine are popular options of opioid agonists in the pre-hospital setting. Non-opioid agonists are available, many of them, as over-the-counter drugs. Many have antipyretic properties as well, meaning they can reduce the patient's fever. All of them offer the production of prostaglandins and something called cyclooxygenase, or CoOx, to produce their effects. Three forms are particularly popular: salicylates, such as aspirin; NSAIDs, non-steroidal anti-inflammatory drugs, such as ibuprofen; and para-aminophenol derivatives, such as acetaminophen or Tylenol. Opioid agonists reverse the effects of opioid drugs. Opioid antagonists reverse the effects of opioid drugs. They bind with the opiate receptors in an antagonistic manner. As a result of this binding, the opioid molecules cannot get to the receptor, and the receptor can't initiate its action. Naloxone, or Narcan, is one of the most common in the pre-hospital setting. Opioid agonist-antagonists have both agonistic and antagonistic properties. They're often preferred because they can decrease pain but not diminish the function of the respiratory system or lead to dependence or addiction. Anti-anxiety, sedative, and hypnotic drugs. Drugs that are used to help a patient sleep through a medical procedure by producing sedation or hypnosis, or both. These are also drugs that create sedation and hypnosis include benzodiazepines, sedatives that are most commonly used to prepare patients for invasive procedures. The exact mechanism of action of these is believed to be the effect of the neurotransmitter gamma-aminobutyric acid in the brain. Barbiturates that are believed to work very similar to benzodiazepines by increasing the affinity between the receptor sites and the neurotransmitter GABA. Opioid agonists, salicylates such as aspirin, non-barbiturate hypnotics, they're believed to work very similarly to benzodiazepine by reducing the affinity between the receptor sites and the neurotransmitter GABA. However, they tend to have comparatively few side effects, particularly in terms of cardiovascular compromise. There are currently no drugs in these categories within the scope of practice for the AEMT. Anticonvulsants. In general term, a seizure is a state of neurologic hyperactivity. These active seizures generally require treatment in the pre-hospital setting due to associated complications. Anticonvulsant medications, the exact mechanism behind them, of course, not being completely clear, but they are believed to work by inhibiting the influx of sodium into cells. They decrease the cell's ability to depolarize and propagate the seizures. Several other types of drugs are used as anticonvulsants, including benzodiazepines, barbiturates, hydrantolins, valproic acids. Stimulants are a common group of CNS agents. They exert their action by excitation of the central nervous system, and stimulating the central nervous system is accomplished by increasing excitatory transmitters, decreasing inhibitory neurotransmitters. Some examples include caffeine, cocaine, or other prescription or illicit amphetamines. They increase the release of dopamine and norepinephrine to increase wakefulness and awareness and reduce drowsiness and fatigue. They increase tachycardia and hypertension. They can cause seizures and psychosis. High doses can also cause increased nervousness, irritability, tremors, and headache. Some people will experience withdrawal syndromes when they stop taking stimulants. Depressants. Depressants are CNS agents that slow brain activity. They may be prescribed to treat anxiety, muscle tension, pain, insomnia, stress, panic attack, or seizures. Some central nervous system depressants are used as anesthetics. Examples include Ativan, Valium, Xanax, and Ambien. Psychotherapeutic drugs. They work by blocking the dopamine receptors in the brain. Many are used to treat illnesses such as schizophrenia and depression. They're associated with a host of side effects, which may include extrapyramidal syndromes, including involuntary movements, tremors, rigidity, muscle contractions, restlessness, and changes in breathing and heart rate, orthostatic hypotension, sedation. Depression is also treated with selective serotonin reuptake inhibitors, or SSRI, monoamine oxidase inhibitors, or MAOIs. SSRIs and MAOIs block the metabolism of monoamines in the brain. Tricyclic antidepressants are also still occasionally used. Drugs affecting the cardiovascular system. The walls of the heart are composed of many interconnected cells that are specialized to serve particular functions. Medications targeting the cardiovascular system are classified according to their effects of specialized cells. The effects of the heart are categorized as follows: chronotropic, which means it affects the heart rate; inotropic, which means it changes the force of contraction; and dromotropic, which alters the velocity of the conduction of the electricity through the heart. All of these can be positive or negative effects. Cardiac glycosides are a class of medications derived from plants. They block certain ionic pumps into the heart cells, membranes, which indirectly increases calcium concentrations. Generally, they have a very small therapeutic index, which means they have a very small margin of safety. They're associated with numerous side effects. Antiarrhythmic medications are long used in the pre-hospital setting to treat and prevent cardiac rhythm disorders. They can have a direct and indirect effect on cardiac tissue. They're mainly classified into groups according to their fundamental mode of action on the heart. Either sodium channel blockers, which means they slow conduction through the heart and have a negative dromotropic effect. Remember, dromotropic means it alters the velocity of the conduction of electricity through the heart. Beta blockers, which reduce the adrenergic stimulation of the beta receptors. Potassium channel blockers, which increase the heart's contractility. Positive ionotropic. They work against the reentry of blocked impulse. Calcium channel blockers block the inflow of calcium into the cardiac cells. They decrease the force of contraction and automaticity, and they also decrease the conduction velocity, which is a negative dromotropic effect. They have antiarrhythmic and antihypertensive properties. By causing the vasodilation of coronary arteries, they enable more oxygen to reach the heart via the coronary artery dilation. They prevent the contraction of smooth vascular muscle. Antihypertensive medications. As many as 65 million people in the United States have hypertension or prehypertension. Antihypertensives are used to treat this hypertension. They have the following treatment goals. They keep blood pressure within normal limits, maintain or improve blood flow, and reduce the stress placed on the heart. Diuretic medications cause the kidneys to remove excess amounts of salt and water in the body. They reduce the level of stress placed on the cardiovascular system by lowering the total fluid volume. They also lower the preload on the heart and decrease the stroke volume. Vasodilator medications act on smooth muscles of the arterioles and the veins. This property explains why nitroglycerin is so beneficial in treating the myocardial ischemia. However, the dilation of these vessels prompts a response from the sympathetic nervous system. When vasodilators are used to lower blood pressure, the patient must also take medications that inhibit the sympathetic nervous system. Sympathetic blocking agents include beta blockers and adrenergic inhibitors. Beta blockers compete with the epinephrine to bind with available receptor sites. They also diminish the effects of beta stimulation. Angiotensin-converting enzyme, or ACE inhibitors, target the renin-angiotensin-aldosterone system. This particularly controls blood pressure. They suppress the conversion of angiotensin 1 to angiotensin 2, which decreases blood pressure. Angiotensin 2 is a potent vasoconstrictor that promotes smooth muscle contraction in the arterioles throughout the body. This constriction raises the blood pressure by increasing peripheral vascular resistance. Anticoagulants, fibrinolytics, and blood components. Platelets repair damage in the blood vessels. That function is critical, but if you have defects in the blood vessels, it can cause blood to flow slow. If blood flows slow significantly, a blood clot or a thrombus will form. Abnormal thrombi may cause life-threatening crises such as a stroke or MI. Antiplatelet agents interfere with the aggregation or collection of platelets. They do not break down aggregated platelets. They only prevent further buildup of these blood cells. Salicylic acid is a significant antiplatelet property medication. It's very important in the prehospital setting, and it minimizes damage to the myocardium in acute coronary syndrome. Anticoagulant drugs work against coagulation to prevent thrombi from forming. Some patients can be prescribed on a long-term basis as a preventative measure. You need to be aware of anticoagulant use, particularly when patients have sustained a traumatic injury and they can prevent life-saving coagulation that's needed to prevent blood loss. Fibrinolytic agents may be administered to dissolve the thrombus and prevent it from breaking off and entering the bloodstream. They promote the digestion of fibrin, which is the protein involved in forming a blood clot in the first place. Used in pre-hospital setting remains controversial, however, and in some cases, in other circumstances, other forms of reperfusion therapy may be indicated, such as transport to a facility for interventional catheterization. Okay, drugs affecting the respiratory system. Oxygen is probably the most commonly used medication in the pre-hospital setting. It has appropriate and inappropriate uses and side effects, and the use of over-the-counter decongestants medication is also common, especially during cold and flu season. Every decongestant varies slightly in terms of this mechanism of action, but all such medications seek to reduce tissue edema, facilitate drainage, maintain patency of the sinuses. Patients may also take antihistamines during allergy season. Try to find out what medications your patient is taking as part of your sample history. Know the effects that these drugs can have on other medications and know the signs and symptoms they can produce. The availability of these and other medications sometimes leads to their illicit use. People have been known to overdose on pseudoephedrine, dextromethorphan, diphenhydramine. Okay, let's talk about some other drugs affecting the respiratory system. Severe respiratory emergencies may often rise from the narrowing of any portion of the respiratory tract. The respiratory tract is lined by smooth muscle fibers that influence the diameter of the airway. Control of the smooth muscles is maintained by the autonomic nervous system. Many of these respiratory emergency treatments attempt to expand this respiratory tract by using sympathomimetic medications. Complications arise when patients with respiratory emergencies eventually experience decreased amounts of oxygen to vital organs. Increased heart rates and greater force of contractions will lead to a higher demand for oxygen, which is already in short supply in a respiratory emergency. Stimulation of the beta-2 receptors, remember beta-2, 2 lungs, beta-2, is the most beneficial to patients with respiratory emergencies. These drugs produce smaller increases of the heart rate and force of contraction, and they decrease the body's rate of oxygen consumption. Xanthines are a second-line treatment of respiratory emergency, and they relieve airway constriction by relaxing the smooth muscles of the bronchioles, stimulating cardiac muscles to work harder and increasing blood flow. They stimulate the CNS. Caffeine is a well-known xanthine and CNS stimulant. Drugs affecting the pancreas. There's a variety of hypoglycemic medications that are available. Others may not act on the pancreas directly. Instead, they alter the way that insulin, which is produced by the pancreas, is used by the body. In the absence of pancreatic function, patients may take insulin injections. To directly affect the pancreas, sulfonylureas increase insulin secretion from the pancreatic beta cells. They're effective only if the patients have residual beta cell function, however. The insulin sensitivity is increased by oral hypoglycemic agents. Drugs affecting the immunologic system. Immunosuppressant medications are often prescribed to patients who undergo an organ transplant or have an autoimmune disease. They're intended to inhibit the body's ability to attack the foreign organ, or in the case of organ transplants, and they inhibit the body's attack on itself, as in the case of an autoimmune disease. They're generally derived from fungi or bacteria and tend to have a very complicated mechanism of action. Essentially, they inhibit lymphocytes and T cells from carrying out their immune functions. Vitamins and minerals, necessary substances that allow for normal metabolism, growth and development, and cellular function. Patients may be taking vitamin and mineral substance to replace deficiency or as a preventive measure. Thiamine is very important in the pre-hospital setting, as it aids in converting carbohydrates into energy. People with alcoholism, among others, tend to be deficient in the vitamin of thiamine. Fluids and electrolytes. Crystalloid solutions are generally used in the pre-hospital setting. They can be isotonic, which means they have the same content of salt as the body. They provide a stable medium for the administration of medication, and they provide effective fluid and electrolyte replacement. They can be hypertonic to help provide nutrition, or hypotonic, which are beneficial in dehydration situations, not hypovolemic cases, however. You may also administer some colloid solutions. All right, next we'll talk about drug forms.